This is your host, Laura Winters, the heart-led pathfinder, intuitive energy healer, speech-language pathologist, and owner of Your Light Holistic Therapy and Wellness, LLC. Welcome to Miracle in Time, a mini-series podcast that brings you the stories of beautiful humans exploring the synchronicities, blessings, and miracles within our perception of time. It illustrates that events are not just happening to us, but for us. Life isn't always rainbows and butterflies, but it is a miracle in time. As a disclaimer, this podcast contains general information about various topics and medical conditions and is for educational purposes and inspiration only. Your Light Holistic Therapy and Wellness LLC is not responsible or liable for the accuracy of information contained in this podcast. The information contained in this episode is the personal views of the host and guests respectively. This podcast is not meant to replace the advice of your healthcare provider and is not intended to prescribe, prevent, treat, or diagnose disease. You assume all risks when you continue this episode. Dr. Madan is the immediate past president for BC Doctors of Optometry. She completed a residency in ocular disease at the Eye Center of Texas in Houston and is a fellow of the American Academy of Optometry. Dr. Madan has lectured on the management of advanced dry eye disease and glaucoma throughout North America. She contributes to the field as a member of the editorial boards for Women in Optometry and Modern Optometry and has authored various publications in review of optometry, Optometry Times, Modern Optometry, and Eyes on Eye Care. Dr. Madan is also a lecturer at Pacific University College of Optometry. She additionally serves as a continuing education reviewer for the Association of Regulatory Boards of Optometry. I hope you enjoy this miracle in time. Hi, Dr. Madan. Thank you so much for talking to me today.
Thank you so much for having me on the show today.
So I made contact with you from another guest that I had on the Thriving Dry Eye podcast, and you are her personal dry eye specialist. And she had such beautiful, wonderful things to say. And so although I was like, this theme will be like going back to all the people, I was like, we need a fresh face. We need a new perspective. There's so much that has gone on in the past 2 years from when I had that podcast. And so I was like, you know what? I do need to reach out to her. Let's make this happen.
Yeah, absolutely. Oh, I'm so glad to hear that. I'm so honored to be in patients' journey when they are dealing with such a complex condition like dry eye disease. And so I'm really glad to hear that, she reached out and that we're able to connect.
Absolutely. So can you tell me, where did all of this start for you?
Absolutely. So I practice in Vancouver, British Columbia in Canada, and my practice is focused on dry eye disease management. And I see a lot of referrals from optometrists and ophthalmologists and general practitioners, and sometimes rheumatologists, just because it is such a complex condition to manage. And I'm really grateful to be in this space, but I wasn't always in this space. So for me, the whole dry eye journey or managing some of the patients with dry eye actually started about 8 or 9 years ago, and I still distinctly remember a patient that really changed so much for me. So this was a woman, she was 50 years old, and she was going to UBC, University of British Columbia, for her PhD program. And she would come in periodically for her glaucoma evaluation and checkup. I was actually managing her glaucoma. And she came in at this point and she, I said to her, and I said, well, your glaucoma looks great. Nothing has progressed. Your medication's working well. Your pressures are great. And she just broke down crying. She just broke down crying and she said to me, then why do my eyes hurt so much? Why are they red all the time? Why are they so irritated? I'm actually thinking about quitting my PhD program unless I find some relief with this. This bothers me so much. And I want to say that's really the first time it dawned on me that, wow, dry eye can impact somebody so much that they're willing to give up their PhD program, something that's so dear to them. And that definitely led me down the path of, evolving from that, learning from that experience, and now just being in this space for the last 8, 10 years. It really is phenomenal. I love connecting with patients. And I think not only hopefully helping them, but I get a lot out of the career as well, from my chosen career, feeling the satisfaction that you can be partners with somebody in the management of such diseases.
I love how you said that, being partners with them. And that's what I feel. Like when I have doctors or specialists or, holistic practitioners, I'm like, we're a team together. We're trying to figure this out. And so if you as a patient are able to find a practitioner, a doctor who thinks that way, I think that's amazing. I feel
Absolutely.
like yeah, I feel like sometimes, I think you hear more than not that the doctor's the one telling you what to do, and um they're kind of on a pedestal, and but to have a team member is really important.
Absolutely. And I think that it is so important. Of course, the doctor has the knowledge, the scientific background, but they don't live with the disease, right? And it is the person who lives with the disease. And I think having them as the partner, hey, this is going to work for me. This is not going to work for me because of such and such barriers in my lifestyle. I think it's really important to talk about those. And I think you really nailed it. Listening to your patient or seeing a practitioner that actually listens is so important. I want to share a dry eye study that just came out and the results of it. And this was a study that actually just came out in 2025, right? So in July of 2025, and it looked at almost 70,000 people were included in this study. And they were looking at personality of dry eye and how personality relates to dry eye, right? Pretty fascinating stuff. And what they found in the study was that patients that are higher neuroticism, so these are patients that are maybe more anxious, maybe have more mood disorders, more emotional, higher stress, are likely to experience more dry eye, and they're also likely to report higher symptoms of dry eye versus now patients that are more extroverts or extrovertism tend not to report dry eye as much or had lower almost incidences of dry eye. But what I really took away from this study was that, we've always thought of dry eye as just a sign and a symptom disease, right? Here's your signs and here's your symptoms, boom, and this is how we treat it. But what this study really highlighted is that dry eye is also a personality disease, right? How we feel impacts how our eyes feel, and how our eyes feel impact how we feel. And if we don't connect those dots, I really think we can leave some patients definitely not heard and definitely not listened to. And when we do, actually just take the time to listen to some of these patients, I think that can be very healing and therapeutic as well. So really important, to find people. And I think it probably relates to not just dry eye, but I'm sure of other chronic conditions as well.
Yes, and I love when you had reached out after I did, you said I listened to both of your episodes, and I really appreciate that. So you know where I'm coming from. But I remember when I was having the worst amount of pain, when I was in the darkest times, it was when my anxiety was super bad and when my depression was super bad. I felt like I was trying to have control of something that I felt like I didn't have control of, which is kind of funny because it was probably part of the point in the lesson. You don't have control of this as much as you want to. And so in my healing journey, it's like when you're able to surrender, when you're able to step back, when you're able to go like, there's a greater plan here. There's more for me. This is not something that has just been done to me to like increase suffering, but it's something to empower me and to change me so that I can become better. And I think that's 70,000 people. That is a lot of people in a study. And so, yeah, I totally see that. And like you said, I think that does resonate, and it moves to all of these different areas of chronic disease and other things as well.
Yeah, absolutely. And when I actually listened to your podcast, that really hit me as well, right? That this is any of these chronic diseases aren't, they're not the only things that can define us, right? That we do have control of other things. And that's kind of what we need to focus, that sometimes these are wake up calls, and they just help us reflect on what's going on. And again, having a practitioner again, in just the whole healthcare system, I think we can really benefit from that. So some of these studies are so important in bringing that to light as well. Now, overall, I do feel dry eye is not taken seriously, right? And I think that's been your experience as well. We've always thought of dry eye as, or at least it's looked at as like, oh, it's dry hand, dry feet, dry eye. What's the big deal? Let's just put some artificial tears or lotion and off we go. But what we don't realize is dry eye can be so inflammatory and can have such a profound impact on a patient's quality of life. Another really cool study that I came across, and this was actually back when I saw this PhD student and went down this journey of dry eye, and looking more into it, was this study on utility scores. And so what they looked at was they looked at a lot of diseases that can have an impact on a patient's quality of life, and they gave it a utility score. So if a disease has a high impact on your life, that's going to be a high score. And if a disease has low impact, low score. So something like flu, that's not going to impact your life too much, would get a low score, but something like cancer would get a high score because that has the potential to really affect your life. And so what they found in this study was that patients suffering from moderate to severe dry eye disease, so moderate to severe dry eye disease, the utility score that they got was very similar to patients that were suffering from angina, that's heart pain from heart attack, and patients that were on kidney dialysis due to kidney failure and were going into hospital 3 times a week for kidney dialysis. Like, can you imagine that? That blew my
Wow.
mind. Yeah, right?
Absolutely. But I can say, like it's funny, I was hoping at some point, and maybe I will, but I wrote kind of a song, and one of the lines was like your I can't remember exactly what it was. I'm sure I could pull it up, but it was like your every blink is running through your head. Like every time you blink your eyes, it's that reminder that this is what you're feeling. Like there's never a time where you didn't feel it because it was constant. Every time that you would blink, you'd feel it. There was never like relief from it unless you were sleeping and you hope that you didn't open your eyes up in the middle of the night because it was going to be really bad then. And I was thinking about this actually, I think it was yesterday morning, like, but that doesn't discount, someone who has like a really bad injury to their leg. Like, they're probably still feeling the pain even just sitting, but it was just a different perspective. Like, yeah, just literally, we blink so many times a day,
To
probably more than like anything else that we do. We're swallowing all the time and we don't even know, but like we blink all the time and we're not conscious of it until it's a problem.
Exactly. And I think the problem was that all of those conditions got validation, right? If you had a leg injury, that got validation. If you had kidney failure, that got validation, but dry eye didn't. And that's what the problem was, is that these patients were just not feeling like they were heard or cared for, and that it just wasn't taken as a serious disease like kidney failure. But so studies like this have really, started to highlight that no, this is pretty serious. And I'll also say, I mean, the reason why dry eye can have such an impact and sound so simple, because one, our eyes are our most important sense, right? Arguably our most important sense. We'd rather lose anything except our vision. And so if there's something going on with our eyes, our vision, of course, it's going to create a ton of anxiety and a ton of stress. And then the other thing is the front surface of the eye actually is the most highly innervated part of our body. It has the most amount of nerve endings of anywhere else in the body. So it's very sensitive, right? And if things are going on in the front surface of the eye and those nerve endings are triggered, well, guess what? Your brain's lighting up like a Christmas tree, and it's very aware of what's going on. And so those two things together, it really is no wonder dry eye can have such a big impact.
Yes. And when I have not been active in the dry eye groups. I needed to definitely step away from that, but you do find that nobody's nobody except the people in those groups are really listening. Hopefully their doctor is,
Yeah.
but when you try to explain it to family or friends, it just falls short because you're right. You don't see it. You don't they can't see the impacts, like the physical seeing of what's happening with the eye.
Mhm.
It's just what you're feeling and experiencing on the inside.
Yeah, absolutely. You're so right.
Yeah. So you had this experience with this patient, and then what was it like to dive into that rabbit hole, and how were you able to bring in some of these things that maybe you didn't already have in your practice?
Absolutely. Again, so that encounter with that patient kind of set off that journey. But since then, of course, I've seen so many patients, and it really is heartbreaking. I've seen patients that have had to cancel weddings or have had to change jobs and careers, and now we're seeing dry eye even in younger population. Before it used to be, the postmenopausal woman was kind of your demographic for dry eye. Now it's a lot of younger folks, and the impact, of course, it can then have, especially if you are a young mom or a young dad and you've got kids and you're dealing with dry eye on top of that, can be quite debilitating. And so I think just from that empathy, from, kind of helped me drive the science and the research and looking more into dry eye. And I think we do now see so many more studies about dry eye. I mean, when I went to school, there wasn't as much research, and now there definitely is. And so there are resources available for doctors to learn more about it. There are new technologies for treatment and for diagnosis of dry eye disease, which is changing, which is exciting, right? When we look at the research side of things as well. And yeah, so it's really helped me kind of elevate my practice and help meet those patients' needs as well, and drive a lot of a lot of personal satisfaction from being in this space as well.
So I'm thinking okay, so you kind of shift your practice and to really focus on dry eye. Now, I'm just thinking real quick because I've never discussed this with anybody, but the equipment itself. So, what are some of the pieces of equipment that you've had to bring in? And I'm thinking about the cost of them being so much. And was it are you the head of your practice where you can make those decisions, or are you trying to convince the head doctor or somebody else that hey, we really need this now and this will come back to us, you
Yeah.
know?
Yeah, I mean, of course, part of treating dry eye isn't just helping patients, but it is a business. I mean, I do have to provide for my family as well. We have to run practices and pay for all the staff. And so absolutely there's a business aspect of it. But I think if you have the right empathy, it's not just selling, right? It really is from a place of this is what science tells us, but this is what I really think that can improve somebody's quality of life. I'm pretty fortunate that I'm in a practice where I am, a partner associate and can help make some of those decisions. And this was a space that I was just really passionate about. And I think having practitioners around you that see that as well and appreciate that. And so we really geared on towards bringing some great diagnostic equipments like mybography, which looks at meibomian glands and can scan them, looking at the inflammation within the tear film, measuring the osmolarity of the tear film, and then of course a ton of treatment options as well, like intense pulse light, which I'm probably you're pretty familiar with. And so those things we've added on to the practice as well, for sure. But it is,
Ah,
you got to just deep dive in.
exactly. Well, no, that's really great that you do have a say and you're able to do that. I'm just thinking way back early on in my speech career, I'm just, working with a patient and they needed a special treatment for Parkinson's disease, and it was okay, me writing a letter, listen, I can send him elsewhere and he can get this treatment, or you can pay me to get the training for it, and this is how many treatments we're going to be billing, and this is what we're going to get from it. And so I was just kind of seeing it from the other side, that like, yeah, sometimes you do have to advocate for your patients to get them what they need.
Absolutely. And we've got to start somewhere, right? We've got to start somewhere, whether it is even, I mean, I see referrals from other practitioners that are not doing dry eye in their practice, but they're so wonderful at bringing in diagnostic stuff to at least diagnose the patient, right? Because that's a huge service to the patient as well. And they're doing a great job of that. And they're saying, hey, look, I really do feel you have dry eye. Let me send you to somebody. And just exactly like what you're saying, right? And then maybe in time, if they feel that's an area that they want to focus on, they can of course add on to that as well. But yeah, we've got to start somewhere.
Yeah. So what do your evaluations look like when a patient first walks in, and like you said, they're being referred from other people typically?
Typically, yes.
Okay.
Yeah.
And then maybe possibly some self-referrals, but like, what does that first appointment look like?
Yeah, absolutely. So yeah, they're coming in from other practitioners. They're probably tried many different things beforehand. Often dry eye patients suffer. What the studies show is that they actually suffer for almost 6.5 years before they even reach out to an eye doctor. Uh, yeah, for treatment, right? Some of these statistics are just staggering. Another really cool one, the word dry eye is actually Googled 3.7 billion times a day. Can you
Oh
believe?
my gosh, that's insane.
Yeah, that equates to 40,000 searches per second. So again, we can see that this is something that's impacting the patient and they're looking for answers, right? So yeah, often when I see patients, they are referred from another practitioner. They've been trying things for at least 6 years, or if not more, trying to find some relief. So we do a very comprehensive diagnostic evaluation, which is looking at some of those diagnostic tests that my technician, my assistant will do, like the meibography, measuring their inflammation or the osmolarity of the tears. And then I really sit down with them for good 45 minutes, to take a thorough case history. Because I think, again, if we're looking for dry eye disease, that's kind of where it starts, right? So we talk about their hormone health, if there are autoimmune disorders, we talk about the pillars of wellness, right? How much sleep are they getting? What is their nutrition like? What is their stress level like? And so all of those things can have an impact. So I often like to really spend a lot of time with them figuring out some of the pieces of the puzzle that could be contributing. And then we spend a fair bit of time on coming up with a treatment plan. Hey, this is kind of what I'm seeing and hearing. This is what I'm suggesting. What does this look like to you? Do you think this is, what are some barriers you see in here, trying to do this? And then, of course, it's really working with the patients. So sometimes I see patients that are, that want very holistic approaches, and they have the time and the self kind of motivation to do those holistic approaches, and that's so wonderful. And that's always such a great starting point. So I don't want to be shoving drugs down their throat either, right? But I also want to then see them back and follow up and provide feedback and say, hey, I think that's really working. I say we keep going with this, or hey, let's tweak it a little bit. Let's see what we can add on to it. And then, of course, there's patients that are very advanced in dry eye, and sometimes you just have to throw the whole kitchen sink at them and see what sticks. And we, of course, have conversations so that they understand what's going on. Because I think once we understand, we're better able to help ourselves. When we're just told, take this prescription, it doesn't stick.
I don't know how it is in Canada, but in the United States, typically when you're meeting with a doctor, you get 5, 10, maybe 15 minutes. And so I can just imagine the relief when you have a full 45 minutes with a practitioner to say everything that you need to say, and to talk about sleep, talk about food. I mean, those are things that, like, I think things are shifting where people are going, wait, you're right. No one's talking about food. No, my doctor's not asking me about that. They're not asking me about sleep. As a speech therapist that goes in people's homes, like I see firsthand like what they're dealing with, and I go, oh my gosh, no wonder. Like you can, everything makes sense when you see where people are living. And so when you're pulling that information from them, it's so valuable, and that you're able to have the time to gather that information.
Absolutely. I think that really is the key, right? Is time. We live in such a busy go, go, go society. Our nervous systems are so heightened. And I think, when patients get there, especially for their first consult, I said, just take a deep breath. Like, we're going to do this together. We're going to be friends for a long time. So don't worry.
I love that. So, curious now, what are some things that you do to regulate your nervous system? Because you clearly have this like great personality to just sit back and like give it to me. Um, so I'm curious myself. What do you do to take care of yourself?
Well, I didn't drink coffee this morning, so no, I'm just kidding. Um, well, dry eye is easy to talk about just because I love it and I'm passionate. And so this is easy part, but of course this is, regulating yourself is not easy on a daily basis. So let me not give you that false hope at all.
Aw.
But
Yeah.
I firmly believe in the pillars of wellness. And I think again, if we're educating our patients, we have to kind of walk the walk as well. Um, Absolutely, it's tough. I've got 3 kids, a busy household, a busy practice. And as moms, I think, you tend to put yourself last too. So there's all of those challenges, and not to mention like cultural challenges that we're all kind of dealing with. But one thing at a time, right? One step at a time. I think just focusing on making sure you're getting enough nutrition. I've been really, really good about meal planning. So one thing is just not eating out at lunch, right? At work, and actually just meal planning and bringing that lunch for myself, for my kids. And a change like that, of course, it takes time, but I think it can have a really big impact on our mental well-being. There's nothing that is more important or feels better or tastes better than good health, right?
Yeah,
And
definitely.
yeah, and we take it for granted until we don't have it. Um,
Hmm.
so really just kind of keeping that at the forefront, that I'm so fortunate to have good health. How do I protect it? I think that's the that's the important part.
Yes, that's really beautiful. Okay, so let's talk about treatment because, like you said, and I've heard before, the drops that we get over the counter are like, I love that you said the dry hands, dry feet. Like these is just the lotions that we're putting on. It's just the little band-aid to provide relief in. For some people, it's only a couple minutes. Sometimes a little bit longer. But what are kind of some of your go-to things if you would have to say, like, I know everybody's different, but what are some things that you really love that you get really good relief or results from?
Yeah, absolutely. I think again, before we kind of talk about the treatment and why we look at other treatment options, I think it's really important to understand that our natural tear film is incredible, right? Our natural tears actually contain over 1,500 different molecules that are constantly working together to lubricate the eye, heal the eye, and nourish the eye, right? The molecules that are in our tear film are growth factors, vitamins, minerals, antibodies, anti-inflammatories. And really, there's nothing over the counter that is going to replace what your body makes, right? Our tears are just simply incredible. And so we have to shift away from just using artificial tears to supplement that. I mean, even the best teardrop on the market is going to have 4 of those molecules, and our tear film has 1,500 different molecules, right? So it's just incredible, right? We don't have artificial blood to support our system. We don't have artificial tears that can mimic our own natural tears. So really the root cause of dry eye disease is inflammation. Why are we not making good tears? That's what we need to target, not just supplementing them, right? With artificial stuff. So some of my go-tos would be, of course, looking at some of the root causes. Well, what is not what is maybe not helping you make good tears? Do you have an underlying thyroid disease? Do you have hormonal imbalances? Do you have, just way too much computer use where we're not blinking enough and we're just not producing enough tears because we're not blinking? So of course we've got to look at the lifestyle part of those things, and those are huge, and I can't underscore them when I talk to patients about it. And then, of course, looking in terms of, and from there we go into looking at drops, right? Managing the inflammation on the ocular surface. So I'm a huge proponent of using anti-inflammatory type of medications to help lower the inflammation. When the inflammation is lower, our body just works better. Often I give the example to my patients and I'll say to them, if I'm not like hungry or stressed out, I actually talk way nicer to my husband. And if I'm
Yeah. No kidding. Get real hangry at my house.
And if I'm hungry and stressed out, I mean, none of these functions are going to work great, right? And that's just how inflammation works. So if there's a lot of inflammation in the eye, which dry eye is inflammatory, until we calm the inflammation down, the system doesn't have a chance to actually help produce, go back to that baseline. It's always in that fight or flight moment. So I do think a good starting point would be using an anti-inflammatory medication, not just artificial tears, lifestyle modifications. And if that doesn't bring back relief, then I think there are some really great in-office therapies that have been very helpful. Intense pulse light therapy has been very helpful in rejuvenating some of the meibomian glands, helping the oil glands produce better oils. I also heavily use platelet-rich plasma in the practice to help the patients. And the science behind PRP, platelet-rich plasma, is really fantastic. So our blood, particularly the plasma and platelets, contain so many great healing molecules, right? So when we talk about the tear film having 1,500 different molecules in it, well, so does our plasma, and so do the platelets. They contain a lot of those growth factors. So that's something patients can use to find some relief. And I often explain PRP to patients as like adding a fertilizer for the grass. You know what I mean? So it's a whole bunch of growth factors and things that are going to enrich the soil to help things grow. But it's none of these are like permanent solutions, right? Once the fertilizer stops, well, we've got to make sure the grass still keeps growing. And how do we do that? And we want to kind of employ other factors that are going to also help the grass, right? Like water the grass, improve, make sure there are no diseases in the grass, and all of these other things. So that's where all these other factors come in to help. But yeah, those would be some of the therapies that are safe, and I think patients can really benefit from them too.
Yeah, and I think that the inflammation is huge. I remember when that was kind of like the first thing that I discussed with my functional medicine doctor was like, okay, we need to address inflammation. And it wasn't just in the eye, it was systemic inflammation. Like what exactly, like what are you eating? What are some things, what are some supplements or things that you can take to decrease systemic inflammation? Thinking about, like, for me, it was no gluten, no dairy. And that actually made a significant difference in the amount of inflammation. Like I was having almost arthritic symptoms, and those went away after a month. So it was like, oh, wait a second. This is not just in my eyes. This is elsewhere in my body as well.
Absolutely right. Our eyeballs are not on a stick. They're part of the body. So and our body is, especially your gut, can be such a source of inflammation. It is a second brain. And if we don't have good gut health, it really spills over to every other part of our body. And our eyes, just being so sensitive, are very sensitive to those kind of things. And so they manifest some of that inflammation, but they may not truly be the source of it. But because they get so affected by it, of course, you could start to then cause damage within the eye from that inflammation too. So you're absolutely right. We need inflammation control in the eye, but we also need inflammation control in the body. And they really go hand in hand to actually see lasting relief.
Now, for patients in which you see like very poor diet along with all these symptoms, what are some of the steps that you encourage, relief or healing? Because you could, start the drops and the treatments and whatever, but is that the lifestyle changes? Is that something that you talk to them about and encourage, or is that something where you refer to somebody else?
Yeah, I mean, I'm not obviously an expert in diet and all of these other things, so it really is fantastic to have other practitioners on board that I can refer to. But I do think, if they're having dry eye symptoms, to have that conversation with my patients very important. And of course, we don't want to judge. I never look down on the patient for not having a healthy diet or not walking enough or exercising enough, because all of our struggles are real, and we have no idea what some of our patients are up against. But again, just empathizing to them that, hey, this would really help. Like, how can I support you in looking at seeing if we can help the diet get a little bit better? How can I support you in perhaps getting a little bit more exercise? And I'm here for you. Do you feel like talking to another practitioner is going to be helpful? Or what are, let's look at your day. Let's see if there are things that, that we can do, that can be small building steps to move in the right direction. So some of those conversations, can go like that.
I can imagine that some of your patients, like even when they feel a little bit better, they still want to come see you because they're like, nobody else has listened. Like, can you be my primary doctor? Because I would just love to see you all the time for everything.
Yeah, oh, I'm so grateful. But yeah. It's always so wonderful to hear that. And you do become friends with your patients. You genuinely, I care about them, and then they care about me, and it's just it's a good relationship. And the key to, again, happiness is to have these wonderful relationships, whether it's at home, whether it's with our friends, and where we work. So
Well, okay, so I did want to ask you because I was hoping to have a guest talk about probing. And this is a topic in which I have found that some people are very for and some people are very against, and some people go, well, there might be something there, but not me. And so I'm just kind of curious if you could provide some information to the listeners about probing, what it is trying to achieve or may achieve, if you know, like a potential risks versus benefits, and if you would like where you sit kind of on the spectrum.
yeah, absolutely. Sometimes we'll see patients that come in, and they've sometimes been on some of these Facebook chats, right? And they're really looking for answers and they're really suffering. So they'll come in, they'll make an appointment, and they'll say something like, I only want to talk about meibomian gland probing. I've done all my research, I've looked everywhere, and I think this is the only thing that's going to help me. And so, yeah, I'm absolutely familiar with it. I've had some cases where I've had to do meibomian gland probing. And what I tell my patients is, again, it is a tool in our toolbox. And there are some controversies around meibomian gland probing. There just isn't a lot of research, but I can see where it can still fit into our toolbox, right? So when we look at the meibomian glands, if there is scar tissue built in the meibomian gland, that when we're pressing on them, when we have really used a lot of anti-inflammatory therapies and nothing is coming out, but we can see that the gland is still alive and it's still there, there might be some fibrotic tissue that's built up in it. And then we can use a probe. It's just a very thin, want to say not a needle, but just like a metal probe. And we can stick it in the meibomian gland and help break up some of that tissue so that the liquid can come out, so that the meibum or the oil can come out. Now, what I do tell my patients, and what I find, is probably the most disheartening part, is that often patients think that this is going to solve dry eye altogether. They're going to get probed and then they're not going to have any symptoms. And sometimes that can be very disheartening to deal with, just the expectations. So what I tell patients is that if there is constrictions, if the gland is really just not coming out, but there's good oil there, yes, it can help loosen that. But we still need anti-inflammatory therapies to get to the root of, well, why are we not making good oils to start with, right? There's the plugging issue, but there's also the not a good quality of oil issue. And probing does not address quality of the oil. It's just a mechanical tool to open up the gland. But even if the gland's open, if the quality of the oil is still poor, well, it still does not bring us the relief that we're looking for. So using it in conjunction with other therapies, I think, can definitely make sense for some patients, but I would not rely on it as a source that just helps, and you're not going to have dry eye anymore. And like any procedures, yes, there are side effects, although probing is pretty well tolerated, right? It's uncomfortable, for sure. Yeah, somebody is in your eye very close and they're poking needles. It's going to drive up anxiety. It's going to drive up stress. I mean, I don't like needles close to my eyes. People barely like having their pressure checked, right? Have you seen the air puff test?
Yes.
Let alone needles around their eye. So it can be definitely alarming, but in general, the side effects are not bad. Um, Done with a good practitioner who knows what they're doing, it's a pretty well tolerated treatment.
Hmm. What would the first question that came into my mind was what might cause the fibrosis in the meibomian glands? I mean, is that like just potential trauma to the eye, whether that's too much rubbing or
Hmm.
injury? I don't know.
I think it really still is chronic inflammation, right?
Okay.
We don't get fibrosis in dry eye as an initial reaction. It is more of an end stage disease. Yeah, I mean, trauma to the lid can cause some fibrosis as well, but that's usually like a blunt trauma. Overall, rubbing the eye, unless you're very aggressive for many, many years, perhaps, but little itching, little rubbing isn't going to cause, I mean, that's a problem in its own, but it's not going to cause fibrosis of the meibomian glands. So it really is an end stage type of a reaction that the body is having. It's building those scar tissue because it's been inflamed for so long. So again, it's not a first line of treatment, right? And we do want to manage, of course, we want to catch dry eye disease before it ever gets to that point, and we want to manage it with anti-inflammatories. And if needed, of course, if we've exhausted other options and we can tell that there's just fibrosis and can hopefully rejuvenate that gland, that could be an option for sure.
Yeah. Very interesting. So, next, I wanted to challenge somebody. But so we know, or the research has showed us that dry eye disease is chronic. And that it will not go away. You will not be quote unquote cured. I am curious though on your thoughts of being able to essentially like resolve your symptoms and maybe come to a position where, maybe you're checking in every so often, but maybe this is not something that is impacting your everyday. Do you have any patients like that? Do you believe that that's something that hopefully can come soon? Or, I'm thinking this morning, I was thinking about like a cancer patient, stage 4, they go in and the tumor's totally gone, like, which is a miracle. Have you had any cases where you felt like, man, they did get a miracle or anything? I don't know.
Oh, that's such a great question. And absolutely, I do believe that patients can find a great deal of relief from their dry eye, right? They can definitely have more good days than bad days. Um, and oh gosh, would it be so wonderful to see a miracle story like that? Although I haven't seen miracle story like that, but I've had such great positive stories where the impact on their quality of life is so much lower. They're able to enjoy their day-to-day life. And I think that's where we really need to focus, right? There are so many chronic diseases out there. People have diabetes, but having diabetes does not mean they're not going to live a healthy, long, comfortable life. And yes, they might have to do a few things to manage it, but we can still have a great life. And that's what I think with dry eye disease as well. Even though we're not curing it, there's no cure. There's no cure for some of the, type 1 diabetes or some heart diseases or cancers, but there are so many patients that have a good quality of life. And that's my goal with my patients. I want them to be happy and healthy and not have to think about it every day. But some days if they do, That's okay because we all have bad days.
Yes, yes, we do. So is there anything else that we missed that you definitely want people to know?
I think we pretty well covered it in our podcast today. It was just such a pleasure to talk to you. I think one of the biggest things I want to tell patients with dry eye disease is to really just acknowledge it, right, for them and take and make sure that they take it seriously and make sure that the practitioners that they see take it seriously as well. There was also another statistic that showed, today 1 in 2 patients that come to an eye practice, whether it's ophthalmology or optometry, have complaints of dry eye, right? And patients often visit 3 different practices before they actually find somebody that takes them seriously. So I think so I do encourage patients to really be on that journey, advocate for themselves, and look for practitioners that meet where they're at and that can help them in this journey. And and that's it. And I'm on social media, I'm on some of the channels. If you think of questions, I do love connecting with people, so reach out and say hello, and I can always help navigate, hopefully.
Yes, exactly. And I love talking, with you and some of the other doctors because I think that gives people hope that there are good doctors out there that will listen to them and will provide them with what they need. And so don't lose hope. You might have to like you said, see multiple practitioners to find that person, but there is somebody out there for you.
Absolutely.
So
Yes,
definitely.
stay positive, right? Stay positive. And I think that's one of the biggest things I tell my dry eye patients as well. Really anyone, right? Like you've got to stay positive. Focus on things you can control. And I think brighter days are ahead for sure.
So I actually, with one of the guests, I had this like realization that this podcast, well, I had said this podcast is about miracles, so we're going to talk about miracles. And I went, wait a second, this is the miracle in and of itself, right? And so, my last question is, what advice do you have for others to see the miracles in their life? And while I was thinking about that question for you, the only thing in my head was that you are the miracle. Like what a beautiful conversation, and the information that you gave, both from the scientific person and also the person perspective side, is so important.
Absolutely. Thank you so much. No, I'm filled with gratitude with this. And again, I think just seeing the miracle in life is the small things, right? And sometimes we forget that until it's taken away from us. So it's a good reminder for myself and my children and for all of us to see the small things and appreciate how many things are going right. Our bodies are phenomenal and incredible. Even when I think about the tear film, and I know it sounds nerdy, but thinking that it has these 1,500 molecules, I mean, it gives me goosebumps. I think it's so incredible how our bodies function and how phenomenal they are. So I'm in awe of it. And I'm also just so grateful that we have that and it functions.
Well, thank you, Dr. Madan, for talking to me today. I'm so glad we were able to connect, and I'm very thankful for this conversation. And I am very confident that this will help a lot of people.
Thank you so much for having me on the show today.
Thank you for listening to Miracle in Time. If you would like to explore a theme or know someone perfect for this podcast, please fill out a form on yourlightllc.com/podcast. If you would like to learn more about my services, you can visit the website at yourlightllc.com. I want you to remember that with all life's ups and downs, you are divinely held and guided throughout your journey. Don't miss out on this miracle in time.